Hey, Assalamu alaikum. In this video, we will understand the important topic is piles or hemorrhoids. So, what is the piles? Basically, it will occur in the anal area or rectum area. So, here is a person basically which that difficulty in the defecation due to the hemorrhoid, due to the piles, and bleeding will occur in every defecation time. So this is the large intestine contain ascending, transverse, descending, and sigmoid colon, and appendix and anus. So rectum and anus is involving to produce a pile. So how it is possible and why piles will occur? In this video we will understand the whole story. So please watch the whole video if you want to learn the piles. So this is the fat adipose tissue, and this is the basically the pile formation. This is the out bulging is here is the piles, internal and external, which that is the lump formation will occur. This lump formation we will understand in this video. So here is the lump formation, which that's contain a veins, and these veins basically already present, but the outgrowth of the veins due to the pressure creation, due to the obesity or the basically bad eating habit, no fibric food. So each defecation produce the blood in the poop. Why? Because basically the compression will increase. So the natural cushion system are present in the anal area for expelling of the feces. So this is the external hemorrhoid and the internal hemorrhoid. External show easily near the anus, while the internal slightly difficult to understand. But anyhow, this is the we will understand the basically the blood vessel, the veins. Basically, the venous return will be difficult due to the pressure creation, and this will lead to lump formation, because basically the vein in lower rectum and anus already present, but the veins basically like the it is varicose veins like structure due to the backflow of the blood from the vein into the heart, which that is very difficult, and that is why the impede the blood backflow will lead to remain in the pile region, out bulge in the hemorrhoid region. So here is the poop. For example, this the basically is the digestive waste, which that is very hard due to the constipation, and will create the pressure to the cushion of the anus, which that cushion basically cushion like structure which that present, and which that surrounded with the blood capillary, the veins. This vein basically here is shown in the diagram. Compress, when compress, the backflow of the blood toward the heart is very difficult. So that is why the remain blood intact, which that will lead to rupture the blood vessel, the vein blood vessel, which the rupture, and in this way the impede the um, venous return, and the blood pooling will increase, will lead to rupture, is known as the aneurysm, and in this way the rupturing will lead to cause bleeding. So I hope you make sense about that. This is the pile, and the pile is basically very dangerous things. Basically will lead to increase the blood leakage, and decrease deficiency of the blood will occur. So basically the what is that? The everyone has hemorrhoid tissue as part of their normal anatomy. These cushions of tissue contain blood vessel and connective tissue and the some muscle. So remember, this blood vessel basically will angiogenesis will increase due to the rupturing of the blood vessel and repairing mechanism. So in this way, the blood vessel contain a deoxygenated blood should be returned toward the heart, but it will be difficult due to the pressure creation, obesity, or pregnancy also involved. The symptom of piles is bleeding, pain or discomfort, itching, and the basically on the other hand the swelling or lump formation, and the prolapse formation. Cause and risk factor, which that is important to understand. So the straining during bowel movement, which that also cause the pile formation and further progression. The chronic constipation, which that also, and prolonged sitting on toilet, pregnancy and obesity, as well as aging and diarrhea, which that is the risk factor. Anyhow, this is the important things you should understand: the obesity and the pregnancy, so create the more pressure and not venous return easily, and that is why the pile creation due to the rupturing of the blood vessel. The pathophysiology, if you are thinking about that, so basically let's understand about that. For example, whenever you will eat low fiber diet, like low fiber diet, less in vegetable salads and low fiber, while high fat, which that decrease the bowel movement and difficult to expel this bowel from the digestive system to the rectum and anus, and that is why it will struck into the large intestine, and thus less bulky stool due to the low fiber diet. In this way, the harder stool due to low fibers and a bowel movement difficult. So in this way, the difficulty of the bowel movement will lead to strain at defecation. This strain basically will lead to cause the pressure, and in this the rupture of the blood vessel. On the other hand, it will also decrease the blood return, and the blood pooling will lead to increase the pressure, and this rupturing of the blood vessel will lead to bleeding, and the bleeding will show the red color due to the oxidation. Again, oxygen basically will bind in the air, so that is why it will not show the blue color. So increase the pressure in anal canal, impede the return of blood from the veins in the inner region, and blood pooling formation will occur. In this way, this is the basically the non-inflammatory disease will lead to become inflammatory. So enlarge the cushion of anus will occur due to the more pressure creation. So our body will adapt to increase the cushion, but this increase the cushion required the blood vessel more, so the angiogenesis will occur secondarily. So note important thing is that the pile is not inflammatory disease, but it can be due to inflammation, like the obesity or the pregnancy and other things. So I hope you make sense about that. This is the video about the piles or hemorrhoids, which that occur in our rectum and anus, which that is very difficult, and the surgery to cut these piles is important. So see you in the next video. For this time, bye. Allah Hafiz.